Good day. In health, in MAPEH module number 5, we are going to discuss the continuation of emerging and re-emerging diseases. Let's begin. Re-emerging diseases are old diseases which are previously controlled but once again have risen to be a significant health problem. These are diseases that were once major health problems globally or in a particular country, and then declined dramatically, but are again becoming health problems for a significant proportion of the population. This term also refers to that diseases which was formerly confined to one geographic area, has now spread to other areas. Foot and mouth disease, FMD, is a highly contagious viral disease which affects all cloven-footed animals, cattle, buffaloes, sheep, goats, deer, yak, bison, etc. For its symptoms, the disease is characterized by development of vesicle, blisters-like lesions, in the mouth and feet, excessive salivation and lameness. The mode of transmission is direct animal-to-animal contact, through aerosols, under suitable conditions of temperature and humidity. The virus can spread to other areas at more than 70 kilometers distance with blowing wind. Contaminated farm equipment, tools, utensils, vehicles, clothing, shoes. Through contaminated feed and water. Through people, farm personnel, attendants, milkers, and visitors. Contaminated uncooked food of animal origin containing infected animals. Also, through semen from infected animals. To avoid FMD, vaccination of FMD vaccine that is serotype and subtype specific which provides temporary immunity, so the susceptible animals should be vaccinated frequently. All new animals should be quarantined and vaccinated against FMD before introducing them to the livestock farm. Prohibit the entry of live animals, semen embryos, animal byproducts, including feed from areas of FMD outbreaks. Wash hands, shoes, vehicles, etc. with disinfectants before entering and leaving the infected farms. In case of outbreak of FMD, immediately report to the authority. The avian influenza, or commonly known as bird flu, H5N1. Avian influenza refers to the disease caused by infection with avian, bird, influenza, flu, type of viruses. These viruses occur naturally among wild aquatic birds worldwide and can infect domestic poultry and other bird and animal species. Infected birds shed avian influenza virus in their saliva, mucus and feces. Avian flu viruses do not normally infect humans. However, sporadic human infections with avian flu viruses have occurred. The symptoms are persistent fever, lymphopenia, severe pneumonia or ARDS, exposure to sick poultry, exposure to affected areas or persons. Clustering may be an emergency. How it is being transferred is through human infections with bird flu viruses can happen when enough virus gets into a person's eyes, nose or mouth, or is inhaled. This can happen when virus is in the air, in droplets or possibly dust, and a person breathes it in, or when a person touches something that has virus on it then touches their mouth, eyes or nose. Person to person. To control and prevent this. Protective actions around birds as a general precaution. People should avoid wild birds and observe them only from a distance. Avoid contact with domestic birds, poultry, that appear ill or have died. Avoid contact with surfaces that appear to be contaminated with feces from wild or domestic birds. The H1N1 influenza, swine flu, is the problem we are facing today in the Philippines. The swine flu is one of the major causes of the inflation or price increase of food in the country next to COVID-19. Swine influenza, also known as swine flu or pig flu, is a highly contagious respiratory disease that occurs in pigs that is caused by the influenza A virus. Influenza viruses that are normally found in swine are known as swine influenza viruses, SIVs. The known SIV strains include influenza C and the subtypes of influenza A known as H1N1, H1N2, H3N1, H3N2 and H2N3. Pigs can also become infected with the H4N6 and H9N2 subtypes. Symptoms. The signs and symptoms of H1N1 flu are similar to those of infections caused by other flu strains and can include fever, but not always, chills, cough, sore throat, runny or stuffy nose, watery red eyes, body aches, headaches. Mode of transmission. Transmission of swine influenza viruses to humans is uncommon. However, the virus can be transmitted to humans via contact with infected pigs or environments contaminated with swine influenza viruses. Once a human becomes infected, then spreads the virus to other humans, in the same way as seasonal influenza spread. Prevention and control. Treatment is largely supportive and consists of bed rest, increased fluid consumption, cough suppressants, and antipyretics and analgesics, e.g., acetaminophen, nonsteroidal anti-inflammatory drugs, for fever and myalgias. Severe cases may require intravenous hydration and other supportive measures. Antiviral agents may also be considered for treatment or prophylaxis. See medication. Patients should be encouraged to stay home if they become ill, to avoid close contact with people who are sick, to wash their hands often, and to avoid touching their eyes, nose, and mouth. The CDC recommends the following actions when human infection with H1N1 influenza, swine flu, is confirmed in a community. That's all for today. Thank you, and make sure you apply the preventive measure or health protocols to avoid contracting diseases. God bless.